So early signs. So pediatric patient is having an early sign of respiratory distress. What does it look like? They're breathing fast. Okay, they're breathing fast. Maybe their heart rate's a little bit racing a little bit. Maybe they're a little bit irritable or restless. They just can't settle down because they can't breathe. They're nonverbal. So you have to go to those nonverbal cues of the restlessness, the agitation, the dehydration, not the dehydration, but the tachypnea. Okay. Late signs of respiratory distress, they're breathing for an extended period of time, for a long period of time. Then what you want to think about is, oh my gosh, children cannot, immature immune system, children cannot tolerate it for an extended period of time. Okay. So the late signs that you see, which is when I see those signs, that I'm really nervous and I know that I need to do some type of intervention quickly. Nasal flaring, their nair is flaring because they're trying to keep that PEEP to try and get air into their lungs. Okay. So you'll see the nasal flaring. Happen in one of my classes. I have a 12-minute long video that we actually go through, and it shows all the signs of what respiratory distress looks like in the child. Retractions. There's different types of retractions. You have substernal retractions that are low, you have suprasternal that are high, and then you have midsternal retractions that are in the middle, so that you can actually see how much their chest is pulling in because they're trying to get that air for whatever reason, whatever disease process that's happening. Tracheal tugging is a late sign. If you see tracheal tugging in an infant, they are pretty much getting ready to find a tube or get intubated. They're probably going to need some critical care assistance. And also you'll see some any kind of abdominal breathing is not comfortable for an infant, is not tolerated for an extended period of time. With all of these, with the increased tachypnea, nasal flaring, then because of their heart rate is going up, now when their heart rate goes up much faster, they're not going to be able to have any cardiac output. So the way I think about it is, if your regular heart rate is pumping, just regular loved up at for, let's say, a 6-month-old, heart rate's 105. So it's regularly going 105. Now this 6-month-old has a fever, and their heart rate is going to go, their heart's going to beat much faster. Okay. So they have a fever, their body's trying to get their blood around, they're trying to cool them off. They're basically having this fever response, heart rate goes up. Now, when your heart starts beating much faster, then what happens is it doesn't allow enough time for the heart to fill. So therefore, there's not enough blood going in, there's not enough blood going out. Then that's when you're going to see your signs of decreased cardiac output. Okay, that's where you're going to see the pallor, the modeling of the extremities thing. You're not going to have really good cap refill time, and then you'll have cyanosis. So those are late signs of respiratory distress. So what are we assessing when we look at this? So we want to know their age, because when we look at their age,